Hello dear students, welcome back to another learning lessons in our Physio-Pulse channels. Today we'll discuss about the disorders of tyrosine and phenylalanine metabolisms. So this topics is very much important for your examination purposes. So I am designing these topics simple and exam oriented way. So let's start our topics today, disorders of tyrosine and phenylalanine metabolism. As you know, several enzymes defects in phenylalanine and tyrosine degradations leading to metabolic disorders. And in deficiency of enzymes and the respective inborn errors are deposited by their discussing here under the phenylketonuria is an important disorder. Phenylketonuria is PKU. It is the most common metabolic disorder in amino acids metabolism. The incidence of PKU, that is phenylketonuria, is 1 in out of 10,000 bars. So it is due to the deficiency of the hepatic enzyme like the phenylalanine hydroxylase enzyme and caused by an autosomal recessive genes. In recent year, a variant of PKU due to the defect of dehydrobiopterin reductase, and that has been reported. So this enzyme deficiency impair the synthesis of tetrahydrobiopterin required for the action of phenylalanine hydroxylase. So the net outcome in PKU is that phenylalanine is not converted into tyrosine. So as we have already seen that the phenylalanine, whenever it is converted to tyrosine, it will form dopa and dopa-quinone, and ultimately it can lead to various types of like the hormones and even also melanin. So phenylalanine metabolism in case of PKU, they primarily causes the accumulation of phenylalanine in the tissue and the blood. So etiology is that this phenylketonuria, it is the common primarily causes the accumulation of phenylalanine in the tissues and the blood. Therefore, the results in the increased excretion of urine. So due to these disturbances in the routine metabolism, this phenylalanine is diverted to the alternate pathway, resulting in excessive production of phenylpyruvate. So phenylpyruvate, even also phenyl acetate also form, or phenyl glutamic acid or glutamate form. So all these metabolites are excreted in the urine in a high concentration in the PKU. So phenyl acetate gives the urine in the mausic order. So how phenylalanine is converted to form the phenyl glutamate or phenyl acetate or even also phenyl pyruvate, that we'll see in the next figure. Now you see phenylalanine, we know that the hydroxylase enzyme, it will convert to form the tyrosine. But what happens? Phenylalanine in the help of transaminase enzyme, it will convert to form the phenyl pyruvate, then acetate, and this phenyl acetate with the help of glutamic acid or glutamate, it will form the phenyl glutamate. So these are the metabolites it can accumulate into the body or blood or tissues, and therefore it leads to the phenylketonuria. Why it is called the phenylketonuria? Because of that, the metabolite of the phenyl pyruvate is a keto group or keto acids. So it is called the, and it is excreted in the high amounts through this urine. So it is called the phenylketonuria. So when a patient is manifested with the PKU, so what are the clinical symptoms or manifestation is there? Specifically effects in central nervous systems, mental retardation, failure to walk, talk, failure growth, even also mental tremors and mental retardation or retardation of the PKU. But there are the however many explanations offered. But you know that accumulation of phenylalanine in the brain impairs the transport and metabolism of other aromatic amino acids like the tryptophan, tyrosine. Even the synthesis of serotonin and from the tryptophan is insufficient. So this is due to the competition of phenylalanine and the metabolites of tryptophan that impairs the synthesis of serotonin. So central nervous system specifically, these are the important manifestation is found during this PKU or phenylketonuria is observed, and even also defect in myelin from the observing PKU patients. So these are important, and also pigmentation. If you see, the melanin is the pigment synthesized from tyrosine by tyrosinase. So accumulation of phenylalanine, it can inhibit the tyrosinase and impair the melanin formation. So therefore, the result is hypopigmentation that causes the light skin color and even also fair hair and blue eyes. So all these things are happening due to the deficiency of phenylalanine. So if you see the exact effect is that found in the skin, even also central nervous systems. Now, how to diagnosis of PKU? PKU is mostly detected by the screening of the newborn babies for the increased plasma levels of phenylalanine, which is 20 to 65 mg per deciliter. Normally is 1 to 2 milligram per deciliter. So this is usually carried out by the by this test, and which is a bacterial or bacillus subtili biopsy of the phenylalanine. So this test is usually performed after the baby is fed and with the breast milk for a couple of days by testing the elevated level of phenylalanine. So phenyl pyruvate in the urine can be detected by ferric chloride test. It is another type of test. A green color is obtained here, and the test is not specific since many other compounds give the false positive test. So this is the important diagnostic tools where we can find that the person or the baby or infants are suffering from the PKU. And how to treat this PKU? So if a patient is suffering from PKU, then the maintenance of plasma phenylalanine concentration within the normal range, it is a challenging task or risk of the treatment of PKU. So this is done by the selecting of the foods or low phenylalanine content or feeding synthetic amino acids preparation low in phenylalanine. Dietary intake of phenylalanine should be adjusted by measuring the plasma level. Early diagnosis and treatment 4 to 5 years can be prevent the damage to the brain. However, the restriction of to the protein diet should be continued for many more years in the life. Since the amino acid tyrosine cannot be synthesized in PKU patients, it becomes essential and should be provided in the diet sufficient quantity. So in some seriously affected PKU patients, treatment includes the administration of 5-hydroxytryptophan and DOPA to restore the synthesis of serotonin and also catecholamines. PKU patients with the tetrahydrobiopterin deficiency require the tetrahydrobiopterin supplementation if it is available. So in this way, we can treat the PKU, phenylketonuria. So I think we have covered the phenylketonuria disease, how it is occurred, and what are the etiological process, and even also how can diagnose in the patients who were it is phenylketonuria, and lastly we also conclude that how to treat the phenylketonuria. Now the second disorder which is found through the phenylalanine or tyrosine metabolism disorders, that is called the alkaptonuria, black urine disease, that is also another name. Alkaptonuria has great historical importance, and it was first described in 1649, then characterized in 1859. And now it's the idea of inborn error of metabolism and observation of on alkaptonuria. Actually, it is also an autosomal recessive disorder and is found in one in every 25,000 people. Here also enzyme defect is the important part, and the defective enzyme is the homogenetic acid oxidase or homogeneous oxidase in tyrosine metabolism. So the homogeneous also accumulates in the tissue and the blood and accumulates into the urine, and this is on standing gets oxidized to form the corresponding quinone derivatives and which polymerize to give the black or brown color. For this reason, urine of alkaptonuric or alkaptonuria patients resembles the color, coke in color. So this is the fully enzyme defect alkaptonuria disease occurs. Now the biochemical manifestation, if you see, then the homogeneity set that gets oxidized by the polyphenyl oxidase to benzoquinone acetate, which undergoes polymerization to produce the pigment called the alkapton. And how it is produced, if you see in the figure, it will see that a homogeneous set, it is with the polyphenyl oxidase with the help of benzoquinone acetate. Then again polymerizations, it forms the alkapton, and these alkaptons when binds with the tissue, then it will form the alkaptonuria. So whenever these patients are suffering from the alkaptonuria, so how to diagnose it? Changing color in the urine on standing or to the brown or dark color, simply traditional method to identify the alkaptonuria. The urine gives a positive test for the ferric chloride and silver nitrate test. So this is due to the strong reducing activity of homogeneity and genetic test employed for the detection of glucose and other reducing sugars is also positive with the homogenetic acids. Now, how to treat it this type of disease? Alkaptonuria is not dangerous disorder, but therefore does not require any specific treatment. However, consumption of protein diet with a relatively low phenylalanine content is recommended. So in this way, we have covered our lectures in the phenylketonuria, even also specifically alkaptonuria disease. And another important metabolism disorder is called albinism or albinism. That is, albinism is the Greek word. It means the white, and it is inborn due to the lack of the synthesis of the pigment melanin. It is also an autosomal recessive disorder, and the frequency is 1 out of 20,000. So the basis of this test is the biochemical test, skin color of the skin color, large number of genes, and it is white color because due to the deficiency of or lack of the enzyme tyrosinase, and then decrease in the melanosomes in the melanocytes, impairment in melanin polymerizations, lack of protein matrix in melanosome. So these are the important criteria or important deficiency by which we can see that albinism is happening. Clinical manifestation is that the most important function of melanin is the protection of the body from the sun radiation. Lack of melanin in albinos will make the sensitive to sunlight. So therefore, the skin susceptible to skin cancer, carcinoma, which is observed. So in this way, we have concluded that the three important disorders which is come out from melanin, even also phenylalanine metabolism disorder, it has been discussed here elaborately. So I think if you have any queries, any questions, feel free to give some comments. So thank you for watching this lecture, and hope this session has helped for understand the basics of this melanin and even also phenylalanine, tyrosine metabolism disorders. And if you found this video or lecture useful, please like, share, and subscribe to the Physio-Pulse channels, and do not forget to press the notification bell so you never miss our upcoming lectures in physiology, biochemistry, even also biology. If you have any suggestion or anything queries, please give some notes into the comment sections. And thank you once again, and we'll see you in the next lecture. Until then, keep learning and stay curious.